So I'll introduce myself. I'm Tiffany Coles and I'm the CEO of Thrive365, and we are a SIL provider. We provide services in both Sydney and Brisbane. And today this is a joint presentation with SDA Smart Homes and the Disability Housing Centre. And I'd like to introduce my co-presenter today, Angie Creed. So welcome, Angie. I'd also like to just take a moment to acknowledge the traditional owners of the land on which we sit, and I acknowledge that we're all sitting, in many different places today. And I'd like to pay my respects to elders past, present and emerging. So a very sincere and warm welcome to all of you. Okay. So this is a presentation about predominantly SIL and SDA, a little bit about us and who we are, about SDA Smart Homes, a rundown about supported independent living and SDA, so specialist disability accommodation. We'll cover a little bit about how to approach getting SDA funding and how to get SIL funding, the different service agreements that may in fact be in place, and then the pathway that we have explored that goes from hospital to SDA and SIL. So because we love a bit of jargon, we've got some acronyms here for you. And look, what we will do is actually make this slideshow available to everyone. So we do have email addresses and we're quite happy to send this out to you. So no need to madly take notes. You're probably familiar with the term SIL, so supported independent living, SDA, specialist disability accommodation. What we are using quite a bit of at the moment, so medium-term accommodation, which is accommodation up to 90 days, and then short-term accommodation, which is up to 28 days. And then tenancy. So tenancy is actually a term that's used quite a bit within specialist disability accommodation. And it involves the signing of a lease, the same sort of mainstream lease that anyone else signs. And it's quite a particular strategy that's utilised by SDA. Okay, so just a little bit about us. We are quite new, we're new kids on the block. We were founded in 2017 and we are actually a for-purpose company. We have a director, and the director is based in Melbourne and has quite a significant experience in disability service provision. We have been in Sydney in operation since 2018 and actually kicked off our Brisbane journey this year in April, and we currently have 9 houses in Brisbane. We tend to provide services in the SDA space, and so because of that, we have a majority of residents who actually have quite complex needs, and that includes some complex behavioural support that's required and some complex health support. We use a person-centred active support model, so we ensure that we place the person at the centre of everything that we do. And some of you may be familiar with the work of La Trobe University and Greystanes Disability Services in Leura. I would strongly urge that you have a little look at some of the videos that they've actually got on YouTube, and they're fantastic for describing person-centred active support. We use that model of support to conduct some values-based recruiting for our support workers. So we ensure that people understand the importance of partnership and doing with, not doing to or doing for. So we are very much about trying to ensure that people develop new skills and certainly maintain the existing skills that they have. To manage our more complex support group or client group, we employ a nurse. So we actually have a registered nurse in both Queensland and New South Wales. And we also have a social worker, and the social worker assists us with our behaviour support. So lots of liaison with behaviour support practitioners and also our restrictive practices. So that's a little bit about who we are and what we do. Okay, so I'll hand over to Angie to talk about SDA Smart Homes.
Morning, everyone. Thanks for joining us. Just a little bit of background about the company I work for, SDA Smart Homes. We build new properties for people with high physical support needs. They're built to the Platinum standard under the NDIS SDA standards. We have a couple of assistive technology partnerships, and our iSaint and aerial care products enhance independence and reduce reliance on person-to-person supports in the home. We undertake the property management of the properties that we have in our stock. So we not just supply the home, but we also maintain it in terms of organising leasing arrangements, collecting rents, and making sure that the property is kept to a high standard. We partner with high quality SIL providers such as Thrive365 to provide the care in our properties. The companies we work for, like Tiffany was indicating, specialise in supporting with high and complex support needs. Obviously that's not our area of expertise. We are registered only to provide SDA accommodation. We are not a support provider, and there is a clear distinction in our roles and responsibilities in that respect, which means that from our perspective, we're providing genuine choice and control. Within our company, we might be a housing specialist, but we employ staff that have a background in NDIS and disability support. So we're able to support participants who are trying to access funding to help them understand how best to go about that, and also providing properties that are fit for purpose. We also provide an information service through the Disability Housing Centre. It's an obligation-free information and advice service. So if you've got any queries, if you're a support coordinator or a person with a disability about what housing options might be available to you under the NDIS, we encourage you to contact us, and using our expertise in disability housing, support you to access a property that's right for you.
Thanks. Okay. So Angie, we might move on. Okay, so what we thought might be worthwhile to cover is just what SIL funding pays for. So as Angie mentioned, the SDA is the bricks and mortar component. The SIL funding, so we're the SIL provider, is actually the service component. So the SIL funding pays for all of the person-to-person supports that the person may require. So that's regular staffing supports. SIL also covers public holiday supports. So when we're doing a quote to the NDIS, we include the public holidays that the person may be home across the course of the year. And we also include, look, on average, about 10 to 12 what we call irregular support days across the year. So irregular support days are 24-hour days, and they are generally funded at a higher rate than the regular staffing support hours. And that's simply because they're there in case, for example, the person is unwell, they may in fact require some additional supports, or day program is closed, or community access isn't happening at the moment. So that's the purpose of those irregular support needs. So some of the things that SIL doesn't pay for, and look, not all of these, we have got there from DSP, but obviously, some of these items can in fact actually be drawn from other sources of NDIS or government funding. So certainly with things like groceries, food and utilities, the expectation is that the disability support pension will fund those things for the person. Transport can be covered by the NDIS. So for those of you with participants with the tiered transport allowance, what generally happens is that SIL providers, that certainly we will just charge a percentage of that transport allowance. So we charge up to 75% of that transport allowance. And really it's just a contribution to enable people to access accessible transport across the year. We will actually fund furniture. So in all of our shared areas, we will outfit the house completely, from the fridge to the you know, washing machine, lounges, cups, plates, cutlery, all of that kind of stuff. If someone has their own apartment and they're the only person in that apartment, they will actually need to outfit that apartment themselves. But in many of our homes with single apartments, there are also...
He's a fucking wayward child. Is that a pure raw blade? Sure. Yeah.
Just going to mute everybody, just so you know what I'm doing.
You got carpet burn yet? I've ever applied.
All right, fantastic. Sorry about that, everyone. Okay, so in terms of assistive tech, that's payable generally through people's NDIS plan, and you'll see that there's often an assistive tech budget available for people in their NDIS plan. Any relocation costs and moving, sometimes relocation can in fact be drawn down from the participant's plan, and it's worth actually exploring with the planner whether in fact that's a possibility. Health and allied health. So obviously health is covered by Medicare. Allied health can be covered by the NDIS or under a complex healthcare plan done by the person's GP. So items like podiatry, for example, may in fact be funded through Medicare through that complex healthcare planning. Medication is funded by the DSP. PP&E is generally paid for by the SIL provider and claimable through the NDIS. Otherwise, if participants are wanting additional PPE, then we enable people to access our PPE through our suppliers, and that's a much more cost-effective option for people. And Angie, I might get you to just scroll up for the last item if you could. Thank you. Great, okay. So moving on to you, Angie, and if you can just discuss the costs for SDA.
So yeah, in an SDA arrangement, the NDIS has set some price limits around what's a reasonable amount of rent to charge each individual. So within a shared supported living arrangement, which is the kind of properties that we build and partner with companies like Thrive365, the maximum reasonable rent contribution is calculated as a proportion of their income. So it's set at 25% of the basic disability support pension plus 25% of the supplement and 100% of the maximum rate of CRA, Commonwealth Rent Assistance. It currently sits at about $190 a week per person per room in each of the shared supported independent living properties.
Fantastic, thank you.
Any second.
Okay, so SIL can be provided in a number of different types of properties. So we're obviously focusing today on SDA properties particularly. And so SDA is specifically modified and leased, so specialist disability accommodation. So that's specifically modified, and it can be modified to a range of different standards. They are often new builds, which is fantastic. So SIL can be provided there. We also provide SIL in a participant's own home, and they may actually choose to have a flatmate. So in that situation, we may in fact provide SIL to both. That can include sibling groups, for example. So you know, siblings living together and they may have a SIL provider in home. The other thing that SIL providers often do is actually lease a property. This is usually either a private lease or some organisations will in fact purchase properties. They usually come unmodified, may not necessarily be accessible, and generally suit people with lower support needs. So we ensure that we have a variety of options for people. If at the end of the day we don't have an option that suits someone, we're happy to look at whether in fact we can accommodate a specific request, or alternatively we're really happy to link you up with someone else whom we believe you know, can in fact suit your needs. Okay.
So just an overview of what SDA is all about. So it stands for Specialist Disability Accommodation, and it's an initiative supported and funded by the NDIS. It refers to specially modified properties with features and fixtures that enhance independent living. Within the SDA categories, there are 5 of them. So from your lower needs at basic, then up to improved livability, fully accessible, robust, and then high physical support, which is the properties that we provide. And the intention is they're designed for people with significant physical impairment. SDA is once you're approved for SDA under the NDIS, we'll go into a bit of detail about what that process looks like soon, but just to let you know that that's a lifetime commitment from the NDIS then once you have SDA approved. SDA providers like SDA Smart Homes, we will manage, like I mentioned, the tenancy arrangements and the maintenance requirements with each property. And it's normally rented as a package with the SIL. So obviously for us to supply SDA property, then because the participants that generally move into our properties have, extreme and complex support requirements, we partner with a SIL provider who's then able to support their needs. And in that case, we feel, that's offering some choice and control. In a lot of cases, we're able to offer the anchor tenant, the first tenant, the option of who that support provider will be.
Great. Thank you.
Just a little bit of lag, sorry,
That's
it's
okay.
coming. So in terms of eligibility for SDA, just to keep in mind that it's really likely to be a very small percentage of participants on the NDIS, and then at each of those subcategories under SDA, even smaller proportions. The 2 main requirements are that you have to be able to demonstrate extreme functional impairment or very high support needs, or both. And to indicate that you can't maintain mainstream accommodation. So, clearly for someone who's using a motorised wheelchair, a property that has any sort of steps is going to be completely unsuitable. The NDIS will also require that there's evidence to say that other options have been tried unsuccessfully. And this all comes through in this evidence gathering phase that we'll go into shortly, that's conducted by qualified allied health professionals. So just moving on briefly to the SDA application process. I'm not going to go through it step by step, but just a couple of points to note. As Tiffany mentioned, we'll send out these slides, so you'll have them for your reference, and certainly feel free to follow up with me after the webinar. The first thing is to consider what it is you want to need out of your housing options. So the NDIS has a form which is quite comprehensive. It was only recently released, but it's quite a helpful starting point, particularly for a support coordinator and a participant and their nominees to get together and think about what it is that their goal is. And of course, then to say that you should have a goal in your NDIS plan around, long-term secure housing. At that point, within the home and living supports form, that also triggers to the NDIS that you're going to need a little bit of extra funding so that you can undertake those allied health reports. At the next stage, when it's getting into the collecting evidence, and depending where you are in this journey, you may already have some of those reports, but if not, you will need to consult a occupational therapist who's a specialist in doing SDA applications and assessments. The OT assessments are then compiled after approximately around probably 20 hours of work from an occupational therapist. So that's why you need to have a reasonable budget to support that. And then that's all compiled and submitted to the NDIA, a national panel that reviews all the SDA applications. And then in time, they'll review your application and notify you in writing of the outcome of that. When you get that notification, it will say what category of funded, what housing type, how many people you should be sharing with, if any, all of that sort of information. And also probably most critically, the budget, because that will determine what kind of properties you can start investigating. That can differ quite significantly from perhaps what the OT recommendation was in some cases. So, you know, that may mean that you request to go back and have that decision reviewed. But if not, and you're happy with the decision that's been provided, you can start to investigate properties through the various avenues available. There are a couple of key websites. So the Housing Hub and Go Nest, most SDA providers will list their properties on there. Individual SDA providers through their own websites, and the SDA finder that's provided by the NDIS lists all currently enrolled SDA properties with vacancies. So all of those are available to search for something suitable. At the point that you identify a property that meets your needs, it's within time to ensure that you also you have SDA added to your plan at your next plan review, and to facilitate that, we will provide the NDIS with a quote and a letter of offer of tenancy, and that can then be provided to them for that plan review process. Secondary to this, of course, and subsequent to this, is all of the evidence you need to collect for your support in the home. So I'll hand it back to Tiffany to talk more about the SIL application process.
Sure. So our inquiries come from a whole range of places, so often from support coordinators, but also we receive inquiries through our web from participants, from family members, from a whole range of places. Look, we're always happy to have a conversation with people about the SIL application process. It doesn't mean that you need to be considering us as a provider. We're really happy to share our information and our knowledge with anyone. So what we do is we have a conversation with the person making the referral to try and ascertain their eligibility for SIL. So we will ask what is currently in their plan. We'll ask if in fact they have housing as a goal, NDIS goal, and what their current circumstances are. What we have done quite a bit at the moment is actually look at using people's core supports. So if in fact they are likely to be SIL and SDA eligible. So for example, if you've actually got someone with complex needs in hospital who have quite a bit of core supports available in their current plan, but actually no SIL in their plan as yet, we are really happy to work with people to expedite them out of hospital and draw down on those core supports while we actually undertake the SIL assessment and an application process. So the conversation we have about kicking off the SIL process is that people need an occupational therapist. We've got a whole range of amazing OTs that we work with, and we're really happy to recommend people. The SDA assessment that's done by the OT is generally enough for us to actually use as a functional assessment for SIL. And so that's good. That's, 20, 25 hours of work that can in fact be used for both application processes. We will gather any other information that the person may have. So if, for example, there are some psychology or psychiatrist reports from the hospital, their complex care plans. So if in fact someone has complex care plans around diabetes management or nutrition and swallowing, we'll gather all of those pieces of information. And then from that, what we will do is actually generate a SIL word quote. So that's quite a wordy document that outlines the person's support needs, and it's effectively a synopsis for the planner. So it's a one-stop shop for the planner. The other thing we'll do is generate a roster of care. And this is actually it's an Excel document. It breaks down people's day in half-hour increments, 24 hours a day, 7 days a week. And all of this has to be evidence-based. So that's where, if you're thinking about SDA and SIL for somebody, commencing that information gathering process is so incredibly important, because everything that we submit has to be supported by evidence. In the meantime, what we'll do is we will show people the properties that we've got available. We will arrange a meet and greet of existing residents. We will find out more about what your support needs are, and then we will incorporate that into the SIL word plan. So what we will actually need to do is also include a floor plan in that then outlines the number of bedrooms, the number of people that they'll be sharing with. Are they NDIS participants, not NDIS participants? So effectively the SIL word plan and the roster of care is completed by us once the person and their family or decision maker decides that in fact they want to reside in a particular property utilising Thrive as their service provider. How long the agency takes to process that is quite variable. So once all of this documentation is collated, we will send it to the support coordinator and also to the participant to make sure that they're happy before we actually submit. We then submit to the national SIL team. And look, we have had SILs turn around in 24 hours. Some of them may take a month or two. It actually just depends. What the agency will do is actually make us an offer. So they'll consider all of the information that we've submitted, and they will determine a dollar value that they will offer the SIL provider. We will then have a conversation with the person and with their support coordinator to see if in fact we're happy with that amount of money, or if in fact there are some concerns around that and maybe the person won't be as well supported as they should be with that level of funding. So sometimes there's a little bit of backwards and forwards once an offer is made before the SIL is actually finalised. When the SIL's finalised, we actually do a service agreement. So there's a SIL service agreement with us. There will be a residential tenancy agreement with SDA Smart Homes. There will also be an SDA service agreement with SDA Smart Homes. And once all of those agreements are finalised, we can move towards a moving in date. What Thrive like to do is actually ensure that all of our staff training is performed before the person arrives. So what we want to do is ensure that all of the documentation is in place. We have all of their medications ready to go. Staff are competent in their care. Our registered nurse has been briefed. And they have had good opportunity to meet and greet the other people who are there, and they're happy and comfortable with the move-in. Then we will ensure that furniture is in, assistive tech is done. We do a grocery shop for the person to make sure that they've actually got all the stuff that they like actually in the house, so it feels homely and they feel welcomed. And then they move in and we take it from there. We do participant snapshot every 3 months of people's goal outcomes and also of their satisfaction. And the other thing we have is house meetings on a weekly basis, so that everyone has an opportunity to put forward the things that they like, the things that they don't like, the activities they would like to do as a house, and some additional things that they would like to do as an individual. So that's over and above their community access offering. Okay, so this is, I guess, just fleshing out the roster of care document that I actually touched on before. And this just summarises some of the evidence. So look, we've already actually talked about quite a bit of this. I guess the most important thing about the roster of care is that it's actually ratioed care. So what the roster of care does is break down the staffing ratios for the person at particular times during the day. So for example, someone might be fine to share a staff member with 3 other people at night when they've gone to bed. But when it comes to 6:30 or 7 o'clock in the morning and they're needing to get up and have a change and have a shower and those sorts of things, they might actually be 1:1 or 2:1. So I guess the most important thing to acknowledge is that the roster of care is actually incremented and will change across the day. It will also change on various days. So for example, we may request additional staffing on weekends because people may not actually be at day programs during the weekend, or they may in fact want some 1:1 support to actually go and see family members. We've already pretty much touched on the word quote, so that's that secondary document. In that, we will in fact flesh out why it is that people need 1:1 supports or greater, and that's where all of those medical and OT reports are really important. And we'll also justify why it is that we're actually wanting active overnight, so that's actually staff upright and available all during the night, or if in fact a sleepover is fine, and that's a staff member who sleeps in the house and is available then to for on call if someone needs assistance. Okay.
Okay, I'm conscious of the time, so I'm just going to very quickly skim over the essence of how it is that we transition participants from the hospital setting into our properties. I guess the thing to note is that our properties are perfectly designed for people who have, you know, newly found mobility impairments. So being that they can accommodate any sort of mobility device. So we often get requests from hospitals about accommodating, transitioning people out of the hospital setting. Some of the challenges with that can be that they might be awaiting, they might be very new to the NDIS, they could be awaiting having plan approvals. They, in most cases, don't have an SDA application approved because the timeframes are sort of not aligned with that. So, you know, we like to work with our still providers in our properties to make those transitions and make the arrangements as flexible as possible. So some of the ways that we can do that is working with whatever current evidence they might have, even if they've got sort of hospital-based assessments, which may not be as detailed as what we might need for an SDA application, but give us a good sense of the likelihood that they are going to be suitable for a long-term SDA tenancy. Even within a high physical support SDA property, we're willing to accept people who come from other categories who may be approved for other categories, such as fully accessible or improved livability within reason. So it doesn't hurt to ask. Just because it says it's a high physical support home may mean there are still opportunities. We're willing to be supportive of the support coordinator in accessing SDA funding over time, and we just ask that you at least, you know, work with us to potentially access alternative funding sources such as medium-term accommodation. And recently we've had a degree of success with the Queensland Health rapid response funding. So it's a flexible funding pool which can be used to bridge that gap between discharge and NDIS approval for accommodation related costs. So that can help to cover some of those costs in lieu of having SDA approval or NDIS giving the green light to the medium term accommodation funding. So I guess the takeaway is just ask. We're happy to have those conversations directly with hospital staff who may not even be aware themselves that these options are available.
Okay, so I'll just touch very quickly on the service agreements with the SIL providers. So we will have a service agreement in place. It will outline really clearly the value of the SIL. And then any non-NDIS related expenses. So if, for example, you're wanting us to, if the participant is wanting us to buy groceries, for example, and pay the utility bills, then we will actually set an amount in that service agreement to recoup. That is also the transport allowance as well. So we'll stipulate the amount for transport allowance, and then we'll provide the service agreement, and then that's signed by whoever the appropriate person is. And that service agreement is then in place for the duration of the person's NDIS plan. So we review those in line with the NDIS plan, or if in fact someone wants to do something different. And I'll hand over to Angie to talk about the SDA provider agreements.
So is in a very similar way, we have a service agreement which is relates to the capital expense. That's how it will appear in a participant's plan, and it's based on that quoted item. So and that is basically determined by that approval that the NDIS has set, and then an agreement negotiation with the SDA provider about what budget they will accept for that. It's a annual funded amount, and it's claimed monthly in arrears. On top of the SDA service agreement, we've also got the residential tenancy agreement, which we're required under law as a licensed property agent to have with each tenant who pays us rent. So it's that $190 a week is paid to us through whatever mechanisms suits each particular tenant. We have centre pay arrangements, which most people prefer. And yeah, so the participant tenant signs that agreement with us we offer a periodic lease, which means that there's no end date. There's no then pressure to have to provide unreasonable periods of notice. If you do choose to leave or explore other housing options, that's entirely up to each person. If you wanted a 5-year lease, we'd also be happy to do that, but we just put it completely in the hands of each participant. Okay, so I think that's it for the presentation side of it. I know we've got some questions in the chat, so if people are keen to hang around and listen to us respond to those questions, I think what we can also do is perhaps respond to them in writing. I understand people might have to leave, so we'd be happy to respond to them in writing because I imagine they're usually around more of the details, so happy to circulate those with copies of the slides. So we might take a look at them, but if people did need to leave, happy for you to do that.
Got some excellent questions here. The first one that came up was, are pets allowed in properties and in SIL?
Absolutely. Yeah. I mean, we can't discriminate on someone on the basis of having a pet. Those sort of residential tenancy rules apply in disability accommodation as well. So look, it's a case by case thing. There's a few things to consider, but certainly doesn't hurt to ask. And obviously if it's an assistance animal, absolutely. But even just as a pet, yeah, we're happy to have those conversations. And we're supporting someone at the moment to move in with a very cute little dog.
And the other thing just on pets that we have done is actually conducted staff interviews that are inclusive of the pet, because what we don't want is for staff to then say, oh, I didn't know that there was a pet. So we've actually found that to be incredibly useful, that the dog in this case actually joined in on the staff interviews. It's great.
Yeah, no, that's important because there's a few more stakeholders involved than might normally be. So yeah, that's a good point.
Thanks. Tiff, you spoke about how long the SIL approval takes. Angie, can you just talk about how long it takes for SDA to get that plan review done?
Oh, how long's a piece of string? I think in the same way. I mean, it's going to depend on the urgency of the existing situation. So if someone is in a living environment that's completely unsafe, certainly your application will be expedited, and it's the same for SIL because we need both of those things to be in place at the same time. It just can vary so vastly, but I know that priority is given to people who are transitioning out of healthcare settings and out of residential aged care. So yeah, in the same way, I've seen SDA applications turn over in a matter of days to a matter of several months. But yeah, anywhere upwards of anything beyond 6 months would be a very long time to wait.
Angie, could you speak, or either of you, about the rapid response funding? We've got a few people who haven't heard of it before. I understand it's new and it's just in Queensland, but what is it? How do you get it? How long does it go for?
Yeah, so it's a fairly new flexible funding pool that's provided by the Queensland government for people transitioning out of hospital to sort of reduce the bottleneck in hospitals in transitioning into more suitable community accommodation. And it really is an avenue for the hospital to support that transition with accommodation-based costs, because one of the barriers for transitioning people out of hospital can be they don't have quite the funding that we require under SDA. So, and the NDIS is not always forthcoming with providing medium-term accommodation, or there can be approval processes around that. or they may be waiting for a more comprehensive plan review process. So in the situation where they already have existing core funds that can be used by the SIL provider to provide some of their day-to-day care, and really the only barrier is that accommodation funding. We've had quite a number of participants recently funded for 92 days of accommodation to allow that transition to happen before the NDIS has made full approval. So,
and do you fund that then at the same rate as NDIS would charge? So that $190, and Tiff, could you speak to that question as well for SIL?
Accommodation related costs equivalent to medium term accommodation, so $132 a day is what the Queensland government will fund. Again, you know, that they're looking for an evidence base to make those judgments, and it's up to a period of 92 days. We may only need it for a period of weeks or days or whatever the case may be, but it's certainly there. As soon as any NDIS funding for accommodation kicks in, that ceases. Obviously, you can't be accessing both pools of funding at the same time. But yeah, it's just to bridge that accommodation related gap.
And that, I think it's probably important to note that that rapid response funding is predominantly bricks and mortar, to pay for bricks and mortar. So what it doesn't pay for, or we certainly haven't experienced it paying for service provision. So what we'll do is Angie will use the rapid response funding to pay for the bricks and mortar, and we will then liaise with the support coordinator and the participant around what level of core supports they actually have. So what we'll do is we'll construct a roster of care, which will effectively generate a weekly quote, and we will then draw down on the person's core supports to the value of that weekly quote while we're actually waiting for the agency to approve SIL. What we usually ask for is 8 to 10 weeks of that weekly amount in core supports, because that gives everyone a buffer then.
Beautiful. There was a question earlier about the difference between home mods and SDA funding, and if someone's waiting for home modifications, can they still actually get that SDA funding? And there's been another question about if someone's waiting for those home mods, can they still access the MTA style funding either through the rapid response or through MTA, or what happens if they need an extension if that hasn't come through?
Yeah, so the benefit of having the rapid response funding is that you've got then a period of potentially up to 6 months of transitional accommodation in the event that you're waiting for home modifications, because the building industry at the moment is under a lot of pressure. So all of these projects seem to take an extreme length of time. So it does certainly allow for a longer period of time to be suitably housed while you're waiting for home modifications to be finalised. You won't get both because it's kind of an either or scenario. And it very much depends on the individual circumstances. It's an owner-occupier kind of situation, I guess. So someone who's renting is not going to be generally approved for complex home modifications because the NDIS would be a bit, concerned about whether the owner decides to sell the property or something. So there's a range of considerations. I guess that's what SDA has provided is another alternative, because you certainly, if you are reasonably independent, you can maintain a SDA apartment or villa on your own and have irregular supports come through. There's all kinds of different SDA models as well. So.
Beautiful. You've almost touched on the last question already, which is whether the SDA Smart Homes properties are owned by private investors. And maybe you could speak to that generally in the sector as well, and the different models.
Yeah, generally there are. I mean, there are lots of different capital investment opportunities to fund SDA builds. Our company works with private investors, and so each of our properties is individually owned. Some companies operate off the investment fund models, but it's almost exclusively privately funded. There are, of course, some not-for-profits who have their own SDA housing stock. So yeah, it very much depends on the individual company. But in saying that, yes, our properties are individually and privately owned, as are most rental properties. but we operate under the guidelines of the NDIS, and we are very much participant focused and wanting to offer genuine choice and control.
Beautiful. And the last question for you, Tiffany, just from me, is if you could speak about the role of support coordinators and possibly hospital allied health staff in this process as well, because I know that there's a lot that you do with them.
Yeah. So support coordinators are key, and we liaise very closely with support coordinators. We have I guess, quite a mutual relationship in that we rely quite heavily on support coordinators to get us the information that we require to navigate the SIL process, but we do that very much in partnership. So the support coordinator is far more of an expert on the participants' needs and wants, their vision for the life that they want to live. And so that's important information for us in terms of, I guess, ensuring that we can provide people with options that are going to be of interest to them and meet their needs, but also that we will be putting the participants' best foot forward in any kind of SIL application process. We liaise really closely with hospital as well. So usually the people that we have contact with in hospital have already got support coordinators in place. And so there will often be a network then of nurse navigators in Queensland, for example, support coordinator, hospital social worker, and any other specialists who may in fact provide us with information and transition training around the person's needs. So it really very much depends on the individual and who's actually involved in their care, but absolutely support coordinators are key.
Great, that's all the questions.
Fantastic, wonderful. Thanks so much, everyone, for your participation today. They were great questions, and look, we are more than happy for you to reach out. You have my email address and Angie's email address there. So if in fact you do have an additional question and we haven't answered it today, or something occurs to you when we finish, please don't hesitate to reach out. We're more than happy to share what we know or find out if we don't. We will make the slides available to everyone who participated today, and we have also recorded the session, so that will be available further down the track for access as well. So my thanks to everyone, and goodbye from me.
Thanks, everyone.
Hi, everybody. I just might quickly jump in. I'm Ashley. I'm from the Long Stay Rapid Response. Just because we got mentioned before, I thought I might chime in and say something. Thanks for giving us a mention before. Yeah, so our whole premise is to help facilitate discharge of long stay patients from hospital. So we do have set criteria for who would be classified as a long stay patient, but yes, absolutely, we have a funding pool to support people transitioning out of hospital, particularly when the barrier is finding suitable accommodation for them, particularly those who have complex needs or SDA equivalent housing needs. We actually can fund lots of other types of solutions. So sometimes that can be actual care support. So I know you guys were talking before about drawing down on core supports until NDIS approve a SIL, which is definitely true, but we can actually provide co-contributions from a funding point of view for that care. We can also provide the funding for assistive technology and for home modifications if there's delays with NDIS as well. So just thought I would mention all of that.
Fantastic. That's brilliant. Thanks so much.
Thank you. Yeah, no, that's great. Thanks for joining us too.
No worries. I had this on the background. I was like, oh, they're talking about us.
Yeah, no, that's you.
Fantastic. Thanks, everyone.
If you go on the Queensland Health website, you can just type in Long Stay Rapid Response and get in contact with us that way.
Brilliant. That's
awesome.
wonderful.
Thanks so much.
Thank
no
you.
worries. Thank you.
Bye, everyone.
Thanks, everyone.
Bye.